start, I would want you to rate on a scale of 1 to 10 the quality of your sleep. And hold on, keep that number in your mind. What if I told you the most powerful thing for your emotional state, your mood, and your focus does not happen at a therapist's office or at a gym or any of these places, but happens at your subconscious level of mind? We all know sleep is very important, but did you know that it's actually a fundamental maintenance for your brain, your memory, your mood, and so many more? And what if the number that you rated is below 6 or 7? You're not alone. Most of our sleep quality is compromised. Hi, I'm Dr. Naidila, and today I would like to go beyond the typical 8 hours of sleep and dive you deep into the psychiatric perspective and the science behind sleep and debunk most of the myths regarding sleep and help you with clear sleep hygiene strategies that would help you sleep better. Think of your brain being stuck like you're stuck in a metropolitan city traffic, and that's the day duty of your brain. But the night shift is what does the magic. And these are the three critical things that your brain undergoes when you're sleeping well at night. Firstly, sleep does your janitor's job. For example, cleaning all the dirt, the toxins, all of this from your brain, it's flushed away, decreasing even the risk of Alzheimer's dementia because even beta amyloids get flushed away in this process of good sleep. Secondly, the librarian's job, where all the memory that you've stored, you've studied and read throughout the day or processed throughout the day undergoes long-term potentiation only when you sleep well. So, before exam, if you're not going to sleep well, then definitely it's not going to the long-term potentiation process. Thirdly, the therapist role. And as a psychiatrist, I'm very fascinated how this REM sleep can gather all the pressure, the emotions, the extreme things that happen throughout your day and works like your own therapist at night when you get a good REM sleep. Sleep and mental health is a bidirectional spiral. They're so interconnected that if sleep is disturbed, mental health is not all right. If mental health is disturbed, sleep is not all right. So, when you're sleep deprived, your amygdala is activated and it sees everything as a threat and acts as an alarm. So, every small thing that's not dangerous also is perceived as a threat, giving rise to symptoms of anxiety. And also, your serotonin, dopamine, norepinephrine, all the balance is lost, giving rise to depression or maybe even bipolar if you have a high risk for it. And also, the next day when you wake up, you're so tired if you don't get a good sleep. Can you actually function well in your sleep and give your best or be at your maximum potential? So, sleep definitely plays a huge role in your mental health, your well being, and also your emotional regulation. And also, coming to various mental health disorders, they have different pattern of sleep difficulty. For example, if it is anxiety, they have difficulty in initiating or falling asleep. For example, you go to bed, your head is racing all the thoughts, thinking of all the things that have happened throughout the day. So, your brain never switches off. So, you cannot fall asleep. So, that's the typical pattern in anxiety disorders. But whereas in depression, there is early morning awakening, ideally probably 2 hours before the usual wake up time. So they wake up at that time earlier than their usual. Because of this, they feel that there is no energy, I cannot do anything, and all the bad thoughts or all the low mood sets in, and starting the day or kick-starting the day becomes very difficult in people with depression. And this sleep difference can be used as a way to differentiate between whether it's an anxiety disorder or it's a depressive disorder as well. And talking about bipolar, also today when I did morning rounds, there was a case. She was on regular medication for the last 7-8 years, but she recently, 1 week ago, she had a ritual at home. So she had to stay awake at night. And immediately from the next day onwards, she has full blown symptoms of mania and also in PTSD. So talking about PTSD, they have a lot of nightmares or flashes that keep coming about all the traumatic incidents that have occurred, making sleep feel very unsafe. Also, a special note to parents of children who are teenagers. On the onset of puberty, the whole circadian rhythm or the sleep cycle changes. So, your child, your son, or your daughter is not lazy. Just that the puberty has changed your circadian rhythm, and stop calling them lazy. Let them get the sleep that they require. Okay, now we know what the problem really is, but what to do with it or how to actually make things work better for you regarding your sleep. The common myth is everybody thinks you come to a psychiatrist for sleep and we only give you sleep pills. Definitely, that's not true. There are a lot of evidence based sleep hygiene techniques, which is the first line that we advise. And after that, if that doesn't work or that does not seem enough, only then we give you medications. So, firstly, talking about the sleep hygiene techniques. Firstly, make your own sleep environment. For example, if it's too cold or too hot, either way you cannot sleep well. So, temperature control. Nextly, make sure that the light is off, because only when the light is off there is melatonin secretion, which gives rise to a good sleep. Thirdly, also sound. Make sure that there is no lot of noise that is happening around you, which will disturb your sleep. And also make sure to use your bed only to sleep and no other activities like sitting and eating, studying, or writing, or doing your work from home jobs on your bed. Next, talking about setting your circadian rhythm right. Firstly, have a fixed routine, because your biological clock needs a routine to understand when to wake up, when to be alert, and when to rest and when to go back to sleep. So, fixing this, for example, by exposing yourself to sunlight early in the morning, which would make sure that your body is also getting used to that sunlight. And also night, make sure that, again as I said, lights are off so that your melatonin allows you to sleep much more calmly. And few other sleep hygiene techniques that actually work. Firstly is, I think you've heard it enough, avoid caffeine at least maybe 3 to 4 hours before your bedtime. If you still want to drink something, of course you can drink milk, because it increases tryptophan, which actually gives rise to a sweet nice sleep to you. And another thing is, 3 hours before it's better to have your dinner. And also avoid alcohol 3 hours before your sleep time. And 2 hours before, start winding your day. Like for example, stop using your phone or your laptop or even watching TV at least 2 hours before your sleep time. This actually makes your sleep quality much better than it used to be when you use your phone throughout the night or till you fall asleep. You're used to scrolling. And also 1 hour before, start calming down your day. For example, activate your parasympathetic system by having more relaxing exercises or breathing exercises, or even for some of them taking a shower just before going to bed gives them a better quality of sleep. So it is tailor made to what works the best for you. And also, technology has made it very easy by introducing smart watches, smart rings, by making you track your sleep or making you understand when you start needing, to taper down your caffeine. It even gives you notifications to do the same. So let's use the technology to improve our sleep. Even despite the sleep hygiene techniques, you're still not able to feel the sleep was restful enough. This might be an indication that you need more evaluation and also maybe medications. So, one thing, let me make sure, it is not lifelong medications for sleep difficulty. That's the myth that everybody has. So, firstly, we might start giving, as a psychiatrist, we might start giving benzodiazepines, or also there are Z drugs which are solely meant for insomnia or sleep disturbance, or also maybe some antidepressants like mirtazapine or other drugs like quetiapine, which can give you a restful sleep based on what your inner mental health condition is. So based on that is what your psychiatrist decides whether you need medication or not. Do you remember I asked you to rate your sleep quality? Can you comment that number in the comment section? And also let me know what sleep hygiene technique has worked for you, not worked for you. What did you learn new? Also in my description, I'll be putting a checklist of sleep hygiene techniques and also few links related to the same. Don't forget to hit the subscribe button.